The software allows us to create a detailed prescription based on injury or OPD records. It can also include the doctor's signature and stamp digitally, depending on how the doctor has configured it. In injury cases, it also lets us generate injury intimation forms, which can be shared with the safety team, HR, or the hospital if the patient needs hospitalization. From here itself, the information can be sent to the doctors and all other respective stakeholders. Now I'll move to the medical examination or health surveillance module. Similar to OPD, we can also manage medical examinations for patients. We can press this button to open the medical examination registration page, where we can line up medical examinations for the candidates. Please note that medical examinations are conducted based on the templates that we have set up for employees. These are some of the templates visible on my screen that have been preset into the solution. Likewise, the software allows us to create n number of medical examination templates, which can be set up by your nursing staff members, or the initial setup can also be done by our team. Once we select the template, we can capture the medical health parameters for the patients as per the template. We can capture information such as past history, present illness, and family member history. All of these can be configured. We can even configure medical parameters into different tabs. We can capture physical examination, cardiovascular, respiratory, abdominal, or gastrointestinal systems. We can also capture data for central nervous system, musculoskeletal, genitourinary, or psychological assessments. All of this is configurable. Likewise, we have the option of eye examination, where we can capture eye examination results for employees, including near or far vision details. We can also cover investigations, such as blood and lipid profile as per our configured templates. If you look here, these parameters have ranges defined. Rules and ranges can be defined at gender or age levels. These rule definitions can help us auto-detect and highlight abnormalities. Similarly, we can capture audiometry, spirometry, or X-ray results as well. In all these sections, we have the option of Upload a Document, where we can upload the results from devices or third-party reports as a reference document into the software. Once this medical is done, it helps us generate medical reports. For that, we can go here under the Approved Medical Examination. We can generate health card for the employees, download medical reports, and we also have a concept of smart reports. Different categories of reports are available. We can even forward these reports on email to the employees. It also helps us generate the Factory Act forms here, so we do not need to write them separately. These will be auto-generated once the medical examination is conducted. Software even allows us to bulk load examination results through Excel. Same templates work here as well. We can select the template and download as Excels. The same can then be filled with data. This is particularly useful when the medical examination is being done outside through a third party, where you receive the results from them, fill them here, and then bulk load them using this bulk load feature. It also gives us an idea of how our past medical have been done. Based on the medical examinations, we can review the results and download summaries of our test results for past medical examinations. That gives us an overview of how a particular medical examination camp went and what the findings or results were during that camp. We can see which parameters were covered and how many people were abnormal for a particular use case. All of that information can be captured here. Once this is done, we can go back and generate health trends. The doctors and nursing staff members can generate detailed trends and graphs for medical health here. We also have organizational dashboards. We can generate dashboards for multiple years in graphical and tabular formats. We can compare the data across multiple years to see how things are changing for our employees. These graphs and dashboards are available here. We have nearly 50+ such dashboards available here. We can look at these details at different levels and compare one year with another, or compare one designation or one department with another department, and compare their health to do trend analysis if there are any trends identified. We could then take corrective measures as well. All of that can be handled here. We also have nearly 60 such org-level dashboards for comparisons. Likewise, we have separate dashboards as well, including medical dashboards. We also have OPD dashboards available, where we can track how illness cases are moving in our organization. We can compare different locations, designation-level comparisons, department-level comparisons, as well as ailment-level comparisons and trends. All of that can be covered here. In addition to the dashboards, we have nearly 50-plus MIS reports in our solution. As you can see here, we again have 50-plus reports available. This is beyond the export to Excel feature that we have on pretty much every page. You can see that biomedical reports can be generated here. Medicine stock reports can also be generated. These reports are exportable, and for biomedical cases, we can download them and publish them for regulatory requirements as well.